for this workshop, what we did was we wanted to look into our data set and explore how older patients with COVID-19 and blood cancer might be the same or might be different from patients who are younger. And a few important things that we found. So first, we looked at symptoms, how does COVID present? And with regard to symptoms, we actually weren't able to tease out any important differences. It seemed like the older group of patients were presenting in a very similar manner to how the younger group of patients were presenting. The most common symptoms in our data set were fever, cough, and shortness of breath, and that was true regardless of age. There were also, interestingly, a significant number of patients in our data set who didn't have any symptoms. So approximately 45% of the patients in the data set did not have symptoms, which might be something unique to this particular data set. We don't know that. To me, it suggests that quite a few people were being picked up on asymptomatic screening, which was a very common practice at some points in the pandemic among patients who were receiving treatment. So it was quite common to screen for COVID-19 before treatment. And because of that, I think many patients were picked up who might otherwise never have known that they had COVID-19. And the percentage of asymptomatic patients was actually the same in the older group and in the younger group. So that was an interesting finding. But some other things were very different among the older group and the younger group. One thing that was very different was the presence of comorbidities. Major comorbidities, and we classified major comorbidities as heart disease, hypertension, pulmonary disease, or diabetes. So any of those things we considered a major comorbidity. And major comorbidities were much more common, significantly more common in the older group. I don't think that surprises any of us, but that reminds us that older patients are different. And when you're seeing data that is showing you differences between ages, I think you want to remember that you need to make sure that data has been adjusted for comorbidities and taking that into account. Another thing that was different in our data set was which diseases the older versus the younger had. In our data set, the younger patients were more likely to have leukemia and lymphoma, whereas the older patients had quite a large number of different blood cancers. And more of the older patients had CLL. And again, this doesn't tell us anything about blood cancers and COVID-19. It tells us about our data set. And it's really a reminder that when we see outcomes that appear different in older versus younger, we want to make sure that the analysis has been adjusted for other variables that might be driving the finding. And that's why it's so important that we have done a multivariable analysis that shows age is an independent risk factor. And then the final thing that we really explored in that session on COVID-19 among elderly patients with blood cancer was the combined impact of age and gender. And so you'll remember that I mentioned that age and male sex both come out as independent predictors of worse outcomes. So we wanted to look at, well, what does that mean in terms of numbers? So when we looked at outcomes among older versus younger men and women, the very best outcomes were among younger women, so women under age 70. They had the lowest risk of dying, and then the younger men. And then the older women, and then the worst was the older men. And in our data set, they had quite a high risk of dying at 38%, actually. And this is among older men over age 70 with blood cancer and COVID-19.